Imagine failing your exam 4 times and having an exceptional attempt. Everything hinged on that one last attempt. This was the story of Dr. Donald Onuoha. He finally passed the SCA. Hi, Dr. Onuoha. How are you doing?
Fine, thank you so much.
Congratulations on passing your exam. How does it feel?
It feels great. It feels happy. Yeah, I feel,
Yeah.
yeah, I've crossed the hurdle finally.
So I'm excited on what we're going to cover today. We're going to
Yeah.
deep dive into your preparation. What did you change and how did you finally pass your exam? So tell us a little bit about yourself for people who might not know you.
Donald Onuoha, and I am an IMG. I trained in Nigeria before I moved over to the UK. Um, so in terms of GP training, actually in my whole medical journey, I've never done any exam more than twice. However, this consultation skills assessment was proved stubborn and different and difficult. However, all in all, I'm happy I've crossed that hurdle. And it was quite tough. It was challenging. It was grueling. The preparation was grueling. But all in all, I'm really happy it's all done and dusted.
Can you share with us what were the challenges you faced before passing your exam?
The biggest challenge I would say is mainly kind of starting over again. Um, so, and most of the failures I had, it wasn't as if there was so big a margin between my score and the pass mark. It was probably 3 marks, 1.5 marks most of the time. Um, and I know some people actually is as little as 0.5. So the biggest hurdle for me was seeing my colleagues go through and people I have practiced, rehearsed, prepared with. And because I usually like to take everything as serious as I can, um, my exam preparation, I actually put in my best on all sides. I get reviews as much as possible. So one very big hurdle was kind of dusting myself again when one exam cycle is done and I didn't go through. It was challenging. It was quite difficult. Um, yeah, I remember the second SC I did. Like I know prior to that exam, my supervisor was like she wanted to give all the push she can so that I go through. So on the day of the exam, we even had like some revision cases, and she told me, "You have a chance to pass this exam." And that was based on what I was doing just before the exam. But when the result came out, it was 3 marks short. It was so painful and disappointing. So that was one of the biggest hurdle for me. And then restarting again, I know sometimes I cried, sometimes I shed tears. It was really a grueling and torturing journey, but all in all, I'm happy. I can smile. I can look back and smile.
It was quite difficult because you've had this hanging over you for 2 years.
Yeah.
And I know sometimes trainees feel like they don't have a life when this is going through. How did you cope with that?
Yeah, true. Like you mentioned, you don't have any life until that exam is done and over with. I know sometimes my children have asked me, Daddy, when will this discussion end? Um, Not that they didn't want me to discuss, but they felt that this recurrent discussion was taking their dad away from them. And you can't do any other thing. So truly, you don't really have any other life until it's done and over with. But in every cloud, there is also a silver lining. In through it all, I've also learned. I've learned many things, both about myself and things happened. So all in all, I'm very grateful that is done and over with. Yeah.
Now I can see the difference. Now you're more relaxed. And because when we first met, I could see you were quite anxious. You didn't know what was going on. So let's go into your learning. What did you learn? How did you actually change things so that you got to a pass this time around?
Eventually, when I came in contact with you for this last exam, it was 3 weeks to the exam. And to be honest, I wouldn't say that I did so massive change. And again, seeing this failing point was probably marginal scores or marginal points. However, there were one or few adjustments I did in most the three domains that actually helped. So one of them, probably if I start with data gathering, my data gathering, due to generally most of the time I know the breadth and scope of inquiry I needed to make in data gathering. However, sometimes compressing it into 6 minutes, coupled with the anxiety, the stress of an exam, you are being assessed, it was quite challenging. So that will make me sometimes, I might forget one or two points, especially on the red flag areas, and then proceed with the management. But I remember I think probably in the second or third week, or early in the third week of just before the exam, I know there was one practice session we had. And after I fumbled on that data gathering, I was like, no, I can't be doing this with data gathering again now. I had to devise a means that would help me cover all the bits I need to do within that 6 minutes. Um, like the common conditions, the rare conditions, or the red flags, including the psychosocial bucket and the agenda bucket. So that's one change I made in the place of data gathering. Additionally, like the psychosocial or overall, I know we mentioned like targeted data gathering. You probably don't need to ask everything, but target it, which is very important, following your priming of the case. And in the psychosocial, what will be most important? Is it the job? Is it the driving? Is it the how it's affecting the patient at home? So these were some things I would say I refined regarding my data gathering. Then if you come to, for instance, clinical management, I know you did mention something about gift wrapping, making the management relevant to the patient in front of you, not necessarily like the textbook management. So this was one area that also was that I had to refine. It really was helpful.
Gift wrapping to individualize the management plan to that patient.
Yeah.
And then when it comes to relating to others, what did you change?
To be honest, this one can be a bit difficult. And also, seeing the exam is also subjective too. One thing I did do is that I tried to follow the patient, um, watch what they are doing, what they are saying, and I tried to follow because the patient had like the simulator has like the compass where so I tried to follow the patient as much as possible, and then also asked my own doctor questions, the things I needed to do. So that was what I would say I did.
What I've noticed, having helped hundreds of GP trainees, is that so many trainees focus so much on their skills, but they don't think about their attitude. Tell us a little bit about what attitude did you actually develop throughout the journey?
Yeah, I do realize many trainee are struggling with many trainees are struggling with SCA. And in terms of attitude, I will summarize it this way. Number one, it can be done. That I passed it, and that other trainees in our class, in our deanery, in other deaneries, in the 4 nations, even IMGs are passing. So that is one fundamental fact. It can be done. You too can pass. Anyone can pass. I do remember when we had a chat about one case, and I told you I think I did the correct management. I don't know why this didn't go well. That was one turning point when you mentioned this attitude. So I had to forget about what has happened in the previous exams and focus on the one in front of me. Yeah, generally it can be done. This phase will also pass. If you are out there and you are struggling with SCA, it wouldn't last forever. It may be prolonged, the battle may drag on, but it would eventually end. And I would just say keep working hard, keep studying, keep consulting, keep practicing, keep getting feedback from either you get from a mentor. In my own case, I know I had probably 3 different mentors at 3 different times. And the first and the last were very, very beneficial for me. In case you meet someone that wasn't beneficial for you, it's not that the mentor doesn't want your progress or doesn't, but probably he or she may not be able to help you. And it's just the way it is. It's not anybody's fault. So in my own case, I got insight from others. So Erwin did help me. Mentors helped, and that was quite helpful. I watched the videos you asked me to watch. I participated in the SCA
Immersive workshop.
immersive workshop. I did participate in that, and it was quite helpful. So getting help is one way, one of the things that could help.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down in the description below to book a call with me to see how I can help you to pass your exam.
During practice with my colleagues, with other role players, with colleagues, with your supervisor, it helps. Finally, one other area I would mention is, for instance, in my regular day-to-day surgery, I do try to see each case as an exam question, especially if it's something that potentially can come out in the exam. I try to do it as I would do in the exam, and that way I was also getting used to my lines, getting ready for the exam. So generally, additive, cumulative efforts and few modifications here and there, like I described earlier, resulted in my final success.
Could you walk us through what was your mindset on the day of the exam?
Thank you for asking this question. So in my own peculiar situation, it was really, really challenging for me. So there was an incident in my workplace, and someone whom I would say was very, very supportive, critical in my training, came back and said, "I'm afraid for you." So, and this was someone who has been very, very supportive from the beginning when I came. So it was really, really tough, to be honest. It really played on my mind. But what helped me is that, again, one, I realized it can be done. Number two is I had to forget about everything negative, no matter the source it was coming from. And I knew all those negative attacks was geared towards stopping me passing the exam. I had to see them as stepping stones to my success. And again, I don't know, I don't know how others might view this point, but there might be sometimes you might work hard and do everything you know how to do, and things will not go well. Um, there might be other factors that affect someone's outcome. I know in my own case, I do believe in God so much. And on that particular day of the exam, there was one particular video I played. So it was like a motivational video, and it was really helpful. It was a church pastor, a pastor that made some comments, encouraging comments, remarks, and that really lifted me on that day. I could remember myself driving to exam hall with this thing playing on my mind, and just that comment helped. So, all in all, I do owe my success and everything that happened. I know God really helped me, but the people He used, I know He used a lot of people at different time, and I'm really grateful, Erwin. You were also one of them in that final 3 weeks, and I'm very grateful to you.
It is really remarkable to see where you went from to where you've actually accomplished. So tell us about, in terms of your confidence now, how do you feel compared to, let's rewind 2 years ago? Can you tell us the difference? How do you feel as a person?
Well, success is a journey. It's not necessarily a destination. And through the journey, you can learn skills that would help you generally in life. So, in answering your question, I want to digress a little bit. So, after when on the journey or on the road to success, you might have one slip or one fall. But that's not the end. Just stand up again, pick yourself up, reorganize, reappraise, check where there might be one or two things that are not going well as it should, and try to make changes. Um, Regarding going back to the question, confidence, because success is a journey, and at the end, at the destination, I'm really, really, really happy that this hurdle has been crossed eventually. I'm very happy. I'm very confident. I know I would do well as a GP. My patients have said so. My colleagues have said so.
Yeah.
I've gotten good feedback from them. And I also know what I can offer. Leave me with a patient. I know how, how I will give my best to the patient. So my confidence is high, and I look forward to the future with great hopes and expectations.
Could you take us back to on the day of the results? How did it feel when you check it and then you found out finally?
Yeah. So it was really on the day of the result. It, I having done the exam more than once, I knew the result would not show on the portfolio until exactly 5 p.m. Even if you check 2 minutes to 5, it wouldn't be there. So and also due to most of the times I've checked the results 4 times and it was a fail. So that was also playing on my mind. So there was a bit of anxiety checking the results, but that moment I checked and I saw that I passed, I hugged my wife, we celebrated. Yeah, it was a surreal moment. Um, yeah, it was. I'm really happy. I'm pleased.
If you had to speak with a trainee who feels quite overwhelmed right now after failing the exam multiple times, been working so hard, and feels like this exam is impossible, what piece of advice would you give that trainee, Donald?
Mindset change. I know a number of colleagues are still struggling with this exam. Um, so number one point is it can be done. I have passed it. I wouldn't say I'm the most brilliant or the most super intelligent, if there's any expression like that. But my colleagues have passed, other IMGs have passed, people are passing. So number one point, it is doable, it can be done. Um, our stories or our circumstances may not entirely be the same, but the principle is the same for everybody, and that's one, it can be done. Number two is that I would also like to encourage and say this phase will also not remain forever. It may be protracted, it may linger, but it wouldn't remain forever. There is an end. There is a full stop to every statement. There will be a time that it has to end. I would just encourage and say, keep working, keep practicing, keep getting feedbacks from mentors, from your supervisor, from colleagues, and even practice during consultation. Use as much possible moment in time to practice, and I'm sure you would smile at the end of the journey. Keep hope alive.
There is light at the end of the tunnel.
Yeah.
You have to be working towards it, and there are many people who walk through that path. It is not easy, but it can be done, as you said, and you're proof of that today.
Yeah.
What are you looking forward to now?
I look forward to the future with great hopes and expectations. This is the beginning. I know one mentor. He said that getting your CCT is actually that you enjoy GP when you've had your CCT. So I look forward to the future with great hopes and expectation. And this is the beginning.
Thank you so much for sharing your story today. I'm sure it's going to inspire many GP trainees, IMGs, who may not have been successful in the previous attempt, but when they can see that somebody like you who passed, then they can see how you've actually done it and what are the things that they may need to change to get to the result they want to. So I know it's been quite difficult, but I'm honored to be playing a small part in that journey with you, Donald.
Thank you so much. Yeah.
Now you can close that chapter and you can move on to the next one.
I've closed it actually. Thank you. Thank you.